so I'm Anna Cayley. If you hopefully will remember that I am the year lead for final year in CBM. Unfortunately, I can't be with you today because I am doing a Masters in Education over at Warwick, so I'm sorry that you've got me by video instead, but hopefully we'll get through it. In fact, I'm going to try and keep this a little bit interactive, so with the help of Caroline and Mike as well. And my main aim today is to tell you a little bit more about what's going to happen to inner practice, outer practice, and what we're going to be doing back here at the university with the students. So I hope the weather improves a bit more as I go around doing this. Okay, so first things first, we're going to start off thinking about what the learning outcomes are. That's the learning outcomes. So what I'm going to do is actually get you to stop for a second, talk to your neighbours and have a think about what you think the probable learning outcomes for community-based medicine in final year is going to be. It's not rocket science, but just have a think. So I'm going to stop for 2 minutes and then we'll come back. Hopefully you've had a chance now to think about what the learning outcomes are going to be. Basically, we have gone back to basics. This year we're taking all our learning outcomes from Tomorrow's Doctors. Okay, so the student has to work in 3 different domains, the first one being a scholar and a scientist. As a practitioner.
So going back to the smoking cessation issue.
As a professional. Basically what we're saying is, can the students apply what they know to clinical situations in a professional way, and can they learn from this? Perhaps a bit more specifically for community-based medicine, we're really looking at their consultation skills. particularly looking at how they make decisions with the patients, how they come up with management plans, how they use things like law and ethics, how they apply epidemiology, how they communicate risk to patients. It's all about this consultation. We're also going to look in a bit more detail at patient safety aspects, which in general practice is quite a good place to do this. For example, handover, looking at significant event analysis, audits, how we communicate with our colleagues, and looking at aspects of safeguarding as well. So what does this mean in practice? So I'll start with the out of practice. Actually, there's not that much that's going to change for out of practice. You'll still be doing surgeries with the students, and we're still expecting them to be seeing on average 10 patients a day. We expect them to be doing the apprenticeship model still, so looking at not just what goes on in the consultation, but we expect them to be doing referrals. We expect them to be ordering results, writing out the X-ray forms. We expect them to be looking at the results and deciding what to do next with these. If it's a referral, we expect them to be doing either the telephone call or the referral form or the letter, or speaking to the on-call if that's possible to do as well. For the inner practice, again, doing the same things, but really trying to get even more in depth into the consultation and the consultation skills. They will be doing case-based discussions. This will come into their clinical decision making, which I'll talk about a little bit later. But it's really going to be looking at consultations they've had, why they've done what they've done. They will continue to do the video, and we're hoping that they'll be able to video, ideally weekly actually. You have to work out how practical that is, but certainly enough that the student starts to see some changes and is learning from the feedback that they're getting from their colleagues. They're going to continue to do the audit. The audit, we decided, is a really important part of what they do in general practice, mostly because when they present their findings, not just to their colleagues, to the other students, but to the practice as a whole, and then they see how that discussion about what could be changed and how that works out in practice, they start to take on some of the leadership roles as well, start to see how actually what they're doing can make a difference to people around them, not just to other students. And the same with significant events. We're going to get them to start looking at significant events and how they are learning, basically learning from things that they've seen that have personally happened to them, or it could be things that have happened within the practice, and ideally again go to significant event or critical event meetings, and that can be an inner or outer practice. So if there is a critical event analysis meeting happening in the outer practice, by all means please do invite the student along to that so they can see that out, and if they can present something of that, even better. They I haven't put it on this slide, but we're going to get them to do journal club as well, particularly for those students who have seen something slightly unusual, have had to have a bit of a think about the management plan, so they've had to go away, read up about something. So it's like that idea of getting them to think, how did I make this decision when there isn't a lot of evidence out there? Or why are we using aspirin in this case? What's the evidence for aspirin these days? Something topical if they like, but something that links into a decision that they've made. And for the first time this year, we're going to have the role player team come out to the inner practice. So traditionally they would have been back at the university, they would have done role players with a facilitator from the ISU team. This year the role players are going to come out. And part of the reason for that is so that there's more clinicians involved, because quite often the students get a bit stuck when it's a clinical problem. But the role players as facilitators are also fantastic, and you will learn in the inner practice how useful they are in picking up some other things about how the student presents themselves and the words that they use and things like that. So they will look at the difficult conversations, for example, the breaking bad news, dealing with a patient who has a headache, who thinks he's got a tumour and needs a CT scan and is also very racist, a lady with irritable bowel syndrome who's incredibly embarrassed about it. So they'll be role-playing these in the inner practice. Later on this morning, the inner practice tutors are going to go out and do a little bit more on that, learning how to do that facilitation using the role player. Okay, so I mentioned earlier that we're going to be looking at clinical decision making with the students. Now I think this is something that you as tutors are probably already doing, but this is just going to make it a bit more explicit. So before we go any further, I'd like you to stop. Or stop the video, and then with your neighbour, I'd just like you to think about what is it that I'm meaning when I'm saying making clinical decisions, clinical judgments. How do I as a clinician do that, and how am I already doing this with the students? Okay, so that's our time just to stop and have a talk for about 2 minutes, and then we'll come back. Okay, so coming back. So, clinical decision making. First of all, students have already had some teaching on clinical decision making, particularly in year 2. So they should already be aware of this concept. But basically, it's why do we make the decisions we make? What do we base those on? And it links into tomorrow's doctors, particularly the area of the scholar and scientist. So how do we apply the basic medical science, the epidemiology we know, the psychology, the sociology, public health, pharmacology, all these different things, all this stuff we've been learning, how do we take all this body of evidence and experience sometimes, personal beliefs, all that kind of thing, how do we take all of that and help us with the patient and the problem that's sat in front of us? Okay, so that's basically how to translate all the learning into the actual doing. So I'll do a lecture with the students on the first day around this, and there'll be some small group work on that. And also in the middle of the 5 weeks there'll be a law and ethics seminar as well that we'll do with them, which will expand a bit more on this. We will draw out in the case-based discussions and also in some of the e-tutorials more about how students are doing this. So to talk a bit more about case-based discussions. Case-based discussions, if you're trainers, will be used to doing this. What I've done is I've taken each little bit from the Tomorrow's Doctors learning outcomes and I've flipped them on the head and turned them into questions. And in your packs there will be a list of all of these questions. Now I don't expect you to use these all the time. I certainly don't expect you to have done every single one with every single student, and particularly in the out of practice in the middle of a busy surgery, I really don't expect you to be going into this depth with the students. However, it may be worth picking out one or two that you find do work quite well, just to get them thinking about their management plan, getting them onto that next step of why am I doing that? So in the handout there's lots and lots of examples there, but you could ask the student, for example, which bits of this consultation have you actually used to inform your decision about how you're going to manage the patient? What area of pharmacology are you applying to this? You know, what is it that you know about ACE inhibitors in the treatment of heart failure? Why are you doing this? So it's just that kind of getting them to think. How have you identified the patient's ideas, concerns, expectations? How have you used that knowledge of what their concerns are in coming up with your management plan, or how you're going to give them their diagnosis, for example? Has this case revealed a learning need for you, something you need to go away and think about? And is there any research, is there any guidance, any evidence related to this, and how will you use that in this situation? So hopefully you can see there we've got different questions to help draw out from the student what they're doing. Now hopefully at the beginning what this will do is help them to learn how to come up with management plans, how to decide what to do with the patient. Okay, so by the time they get to the end of it you may not need to do this so much. They may even be able to tell you this without asking, but really it's that bit of how do we get that student who can take a history, do examination, has all this knowledge, and how can we help them to move on to this bit where they're actually managing the patient and working with the patient to move on.
Hello, community matron.
So one of the other things we're going to be looking at with the students is going to be safe handover. And so what I'm going to do is actually show you a video that's going to be looking at aspects of safe handover using something called SBAR. So first of all, I'd just like us to stop and look and watch this 3.5 minute video, and then we'll come back.
Hello, community matron.
So obvious places for them to think about using handover is in referrals, so that's either written, going to the hospitals, or referrals such as on the telephone to community matrons. But another place I'd like you to get them to think about handover is in presenting patients to you. So when they finish their consultation and they come back to you, how do they do a handover to you? How do they tell you what their recommendation is on how they want to manage the patient? The other place I'd like you to think about this is what they're writing the notes as well. Again, another place of handing over information so that the next clinician who comes along can read and see what's being said and what the plan is for the patient the next time. Now you may or may not like the SBAR way of doing it, and what I will do in the beginning what I will do in the first lecture with them is talk about SBAR, but say that this is not necessarily something they would do in general practice. But if you do like it, have a think about how you could use that or adapt it for how it's going to work with you in the surgery, with your patients and with your student. Okay, so on Fridays the students are going to be back here at the university. They'll be here to do a mixture of lectures, small group work and e-learning. We've got the ISU team on board again this year, so they're going to be doing the professional conversation tutorials with the role players. These are the ones where the students have to deal with a difficult conversation, for example a nurse or with a colleague who's turning up late. We'll also be doing a lot of work with law and ethics this year, so we've got the team who are going to come to do a session with the students each block, which will be looking again at difficult things for the students to work through. We're also going to be doing OSCE practice with them towards the end of the block. We have finally put together the e-learning tutorials, so we're just still in the process of finalising all of those. These will be more for the students to do in groups, so we expect them to be doing them on Fridays, not whilst they're in practice unless there is spare time. But there is time set aside for them on the Fridays to come here and to do the tutorials in their groups. Okay, so they'll be doing them in small groups, and then there may be some plenary sessions on the Fridays where we can talk through a little bit more about what they've been doing. What I will do is I'll make sure that the tutorials are available for you so you can have a look at them, and then if you choose to do a tutorial, which is brilliant if you still want to do that, then you can look at what we've done and just make sure we're not duplicating what we've been doing with them. So, important of course is the assessment. At the moment, plans aren't that anything's going to change specifically for CBM for this year. The biggest change that you might find with the students, however, is that traditionally they would have had their GP exam at the end of their blocks of doing that. So, for example, there'd be a November exam and there would be a kind of May, June exam. This year, there won't be that halfway exam. They'll have all their stations at the end. So that's about 18 different stations over a few days, as well as their written paper at the end. So that's quite a big change for the students. But also hopefully should mean that in the middle of the year, you won't be getting students who are cramming and not really paying attention. You might still get that in the final, in the last block, but that's probably the biggest change. So just to remind you, we have 2 OSCE stations which are based around a consultation. The first one is pretty much always a new presentation, so the student's expected to take what we call a focused history. By that I mean, if they're going to be asking about past medical history and drug history, it needs to be pertinent to the consultation. Sometimes I find students will be having this beautiful consultation and then suddenly stop and go, oh, have you got any past medical history? Is there any problems in the family? And completely breaks up the consultation. So try to get them, and I will be doing this with the OSCE practice at the end, but trying to get them to make that part of the consultation rather than a kind of awkward bit where they're trying to get points. But anyway, so they will be doing, so they do a history, explain the diagnosis, all the diagnoses, all the problems that they can see to the patient, and then with the patient, very important, coming up with a plan together that the patient's happy with, and there's some safety netting. And we also expect them to explore any areas of lifestyle advice if needed. So that's usually the first one. The second one is often either the patient's coming back to receive a result, but key again for the students, and they often forget this, is that they do still need to take a focused history. Because I don't know if you're like me, but if a patient comes in and you just give them the results without having asked a few questions beforehand to see what's going on, you can completely lose the patient. It can be can go terribly wrong. I give the students the example of the woman who comes back for her thyroid test result, and you tell her that it's great news, her thyroid function is normal, and she bursts into tears, and that's because she's obviously very tired and exhausted, and she's looking for a medical cause for this, and obviously you're taking that away from her, and so it's this worry about, well, why am I feeling like this? So just getting that background, so that's incredibly important even in the results giving station. Then being able to explain what it means, coming up with a management plan, or they might not so much have a results one, but something where there is a negotiating lifestyle changes aspect to it, so alcohol, smoking, diet, exercise, that kind of thing as well. We are writing some things for the acutely ill patient module, which has replaced the medicine and surgery aspects. At the moment we're not being asked to examine for that, but that may change over the next few years, but at the moment just hold steady on that one. So the rest of the PowerPoint presentation that I put together really is just going over what else is happening in the other years, just to remind you, and what they will have already done in CBM up to this point, so that when the students get to you, you know what they've already done. Woo, blowing away. Really, what I want to say now is the summary, okay? So my summary of what I'm hoping the students are going to get out of their 5 weeks with you. I have to look down at my piece of paper. Okay. So really, I want them to be confident in producing management plans in conjunction with the patient. Okay, that's the thing that I really want them to get the most out of their next 5 weeks. Yes, looking at the patient safety aspects, being able to do the full consultation, and being able to deal with those difficult consultations, But really I want them to leave with a real confidence in being able to come up with that management plan with the patient, so that when they start their F1 year they have got the skills and the grounding that they need. So thank you very much for putting up with a little video show. I hope you enjoyed it and saw some beautiful shots and maybe different changing weather as we went around. I'd just like to say thank you to Mike and my crew for helping out with the videoing, and I hope you enjoyed the rest of the day. Thank you very much.